everyone. Thank you so much for joining us. This is Inga Hansen, editor of Metaesthetics Magazine, and we're going to go ahead and get started with the webinar. If you have any questions during the presentation, please type them into the box on the right-hand side of your screen, and we will answer them at the end of the webinar. Today we'll be discussing how radiofrequency-based microneedling treatments can be used in surgical practices to address off-the-face concerns such as stretch marks, scars, and crepey skin, and how lower-cost non-surgical options like radiofrequency microneedling can help expand your patient base. Our presenter is Thomas Trey Sands, MD, a board-certified plastic surgeon in private practice at Colin & Sands Plastic and Reconstructive Surgery in Metairie, Louisiana. Thank you so much for joining us, Dr. Sands.
My pleasure. So thank you so much for the opportunity. You know, when we talk about these technologies or these different devices, I think the perspective from a plastic surgeon's point of view when you're looking to bring some of these things on is very different than maybe some of our other colleagues in the aesthetics industry. And so what I hope today to do is kind of present this from a surgeon's perspective that has had primarily a surgical practice and has been incorporating more of this non-surgical aspects of technology and how it has really impacted our practice and how I think it can truly impact other plastic surgeons' practices. So we'll talk a little bit about, you know, practice differentiation and how mine is a little bit different. We'll talk about some of the non-surgical trends in skin revitalization. We'll talk specifically about the Secret RF platform. We'll talk about not only Secret or Cutaris results, but also my personal results with it. We'll talk a little bit about my consultation process and how I talk to my patients regarding this device. And then we'll also talk about marketing. So my practice traditionally, you know, about 8 years or 9 years ago, I came into private practice with my father-in-law, who was a very well-established plastic surgeon who did mostly surgical procedures and did no real non-invasive procedures and was very successful in his time. He then retired, and then I took over the practice, and my practice has really evolved into more of a surgical practice that is focused on body contouring, body aesthetics and reconstruction, but then also the non-surgical aspects of facial rejuvenation with injectables and so forth. And so, you know, as we've grown, we've really looked to bring in options that fill voids in our practice to really suit the needs of our patients. And then also really enhance what we're doing surgically. So I really stress to my team when a patient comes in, it's not about just what we do surgically, but it's about the experience. It's not just about the result, but it's what else can we provide that allows that experience to become more complete. And so it really is important for all of our staff and members and team to really look at and critique and analyze things that we feel can make what we are currently offering a better experience for patients. And so, you know, when we talk about our body contouring patients, not every patient is a surgical candidate, not everybody wants surgery. And so, and then also too, with regards to our surgical body contouring patients, we really are we're limited what we can do surgically in the operating room. And we still have patients that have some concerns after their surgical procedures that can really be enhanced by other modalities. And with regards to the face, we always talk about with our patients 3 different areas of improvement for facial rejuvenation, that being skin laxity, loss of volume, and then ultimately polishing the skin. And so there's a lot of different things to consider, and I think that's why it's really important for us as plastic surgeons, as surgeons first, to really incorporate and to entertain some of these non-surgical skin revitalization options. So in our practice, instead of being like every other plastic surgeon who wants to do everything, we've really focused down on a couple of different areas and really try to do those things complete and do those things well. And so that is our surgical body contouring patients and our injectable patients, and then really trying to offer everything around those patients and those particular procedures. In our city, we're in New Orleans, and so we have a significant amount of African American patients, Latin American patients, and so we have patients that have darker complexions. It is hot here, the sun is always out, and we really need to be able to provide complementary services that are going to be able to be done throughout the year, that are going to be within the natural trends which people are looking at, and that are going to be safe for our patients as well. And they really do have to make sense for us to be able to do it in-house with regards to being able to delegate and then making sure that it's going to have a reasonable return on our investment. And I've never really saw a point of having a bunch of lasers that are very expensive to own and to upkeep when there's potentially a significant risk with our patient population that has darker complexions. So what is the role of non-surgical and non-invasive procedures in a plastic surgeon's practice? Well, I truly believe that we as plastic surgeons can enhance our surgical results with the technology and be able to better capture those patients that are not interested in surgery. So as plastic surgeons, as a plastic surgeon, I really look for a device that fits certain criteria. It really needs to offer our patients, our patients are really looking for something that fits their particular need, right? And so we want to be able to make sure that it yields consistent results, and it has to be obvious. When I look at something, I want to be able to say that that is an obvious result. I don't want to have to squint my eyes and say, yeah, I think I see a little change there. I wanted to make sure that it's obvious. It needs to be a reasonable price point for patients. And then it also needs to be able to treat, in my opinion, more than just one thing. I look for platforms that we can bring into our practice and we can treat areas on the face, areas on the body. We can do multiple things with it. And I think that makes more sense for our practice as a whole, rather than having a very expensive piece of equipment that does one thing and one thing only. So when we talk about the trends, generational trends with regards to these non-surgical procedures, when we look at, in our patient population and in our practice, we see a lot of families. And so it'll typically start with one family member, and then it turns into a grandmother, mom, aunts, daughters, sisters, etc. And so we really need to be able to have options that fill all of those people's needs. Sometimes these families will come in groups for a consultation, and then they begin to really appreciate the time that you're taking to create a very specific plan for each of those individuals that has very different needs. And the beauty about Secret RF is that it really can be used to treat any one of these patients, no matter what their age is. It can be integrated into their revitalization plan, no matter if they're 20, 50, or 70. And a lot of times now we're seeing patients that are in their 20s and 30s, and they're really more along that prejuvenation aspect, and they're looking at how they see themselves in their selfies and online on social media, and they're looking to really maintain that. So this even really fits into that younger patient population. So we need to understand the market demand for skin revitalization, and this has been very obvious over the last number of years. All of our major national societies, both for the plastic surgeons and facial plastic surgeons, have reported huge increases of these non-invasive and minimally invasive treatments that have increased year by year. So it's here to stay. And if we're not incorporating some of these things into our practice, I think that we're losing out on potential, not only sources of revenue, but also potential opportunities to bring new people into our practice. It's a great way to start the discussion for people. We talk about these trends that people talk about on social media all the time. And we really need to be able to understand these platforms and be able to educate patients on why they're good or why other options may not be good, because they're going to be coming to you and they're going to be asking questions. They've seen it on Instagram, they've seen it on Facebook and all of these other platforms. So as more and more of these non-surgical treatments become available, people are really becoming more aware of things. And so all of these buzzwords come into play: PRP, microneedling, dermal infusion. And we really need to be able to understand these things and be able to talk well and completely about them, and to be able to really offer a variety of things for patients that can, span that that bridge of either low-cost treatments that may just provide a little bit of brightening for the skin, but then also more significant clinical improvements that they may be willing to pay a little bit more for. So all of us are familiar with different skin revitalization technologies that have been available for many, many years. There's microdermabrasion, which is abrasive to the surface of the skin. We typically will see kind of minimal results with that. Chemical peels of various depths and penetration, and IPL and fractional lasers or ablative lasers. And a lot of these lasers or chemical peels that have very significant clinical results come with this problem of recovery and redness and the potential to really prevent that patient from going out in public while they're healing. And the beauty about microneedling is that it is a minimally invasive procedure with multiple needles that generates new collagen, a smoother, firmer, and more toned look to the skin. But it's really safe for all skin types and all areas of the body and all year round. And so because of our darker complexion population here in the city, about 8 years ago, I really started to incorporate the traditional microneedling into our practice, and it really served our patients well. It was a very good price point. The issue that we had with it was that because of the traditional microneedling, we would need to do more treatments to see the clinical benefits that we really wanted to see. There was a little bit of recovery time. It was not as bad as some of our peels and lasers, but there was still about 5 to 7 days sometimes where the patient had a little bruising or a little redness. So let's talk a little bit about the different options for microneedling now. When you look on the left, the traditional microneedling is usually a very small treatment area. It's very limited in its adjustability. It doesn't have any heat or energy delivery. And like I said, the results are very subtle if you're just doing 1 or 2 treatments. And really, to get those very significant clinical benefits, you're really going to have to do this 10, 12 times. When you look at, other RF microneedling devices, they are not all created equal. When I was considering bringing this newer technology in, I looked at a lot of different platforms, and you'll begin to appreciate the fact that Secret RF microneedling device is so very versatile with the ability to change the parameters, to be able to think outside of the box and to treat different areas of that patient, whether it be the body or the face. And because they have non-insulated as well as semi-insulated tips, it allows for further options for treatment. It also, because of the head, it allows for a larger treatment area. It's also one of the ones that has the highest power out. So it has the potential for us to really push the envelope on what our treatments are and what the clinical benefits are. And in my opinion, it had the least amount of downtime as well as the best patient experience. It is a very elegant device, and patients do not complain about the process of the procedure itself. So it lends itself to being a very, very short treatment time. So let's talk, this is one of my staff, and when we first started evaluating Secret RF, this staff member said, I want you to do 1/2 of my face with traditional microneedling and 1/2 with the Secret device. And we said, okay, all right, we'll do that. And it was really pretty outstanding. And I think the picture is worth 1,000 words in this. And if you look at the traditional microneedling on the right, on the left-hand side, you see that you see some of the bruising that the patient's going to walk out with, and that's going to be persistent. And may be able to cover it up with a little bit of makeup, but ideally, our patients would so much rather what you see on the opposite side with the Secret RF treatment, which is like they didn't have anything done. So our patients are literally able to walk out after our procedures and look better than when they walked in. So this is one of our patients who, on the left-hand side of the screen, this is right before her treatment. On the right-hand side of the screen is really right before she walks out of the door after her treatment. And so this allows us to be able to schedule patients in 4 weeks. The next 4 weeks, as soon as they're able to, they get back in here because they don't have to worry about that significant downtime. And that's the beauty, because you can really stack the schedule up much more efficiently. You can get to those clinical endpoints and clinical significant treatments at a much quicker rate than with traditional microneedling or with a device where you may have more downtime. So this is the platform, Secret RF by Cutera. Their catchphrase is skin revitalization from the inside out. And the reason for it is because this platform uses unique radiofrequency energy that's applied through these microneedles that induces more collagen production to improve the overall appearance of the skin. It really does have the ability to address many areas. When it was brought into our practice by the company, they really were talking more along the lines of treating face and wrinkles on the face and scars on the face and so forth. But as a plastic surgeon, I looked at it as being potentially treating so much more all over the body. These areas of crepey skin, these areas of the scars and stretch marks and on the breast and the abdomen after our surgical patients. So I really saw that this, we'd only touched the tip of the iceberg with this device. So some of the advantages of the device itself, when you look at it, this is one of the 64-pin heads. When we look at this device specifically, you get multi-layered dermal remodeling from the inside out, and that's where that phrase comes from. It is very, very precise in the way it produces the fractional injuries with the RF energy. The treatment time is very short at about 20 minutes. And because the patient is so comfortable doing it, it is really safe for all skin types all year round. And this is really what we want. We want to be able to treat any one of our patients that comes in. It doesn't matter if it's 100 degrees out in December or not. We don't want them to have to worry about it. And we delegate this to our estheticians here to really be able to optimize, me being able to be in the operating room and not having to worry about what they're doing with the device that's extremely safe. The interface is extremely intuitive and very customizable for our esthetician to really kind of tailor their treatments based on the patient's needs. When you look at some of the adjustable parameters of this device, there's multiple hand pieces. There's a smaller hand piece that allows you to really get in and precisely treat smaller areas. And then there's a 64-pin piece that allows you to have much more rapid treatments over a larger area. These 25-pin options come in non-insulated as well as the semi-insulated, and the 64-pin comes in the semi-insulated needles. And so we will typically use the semi-insulated 64-pin for most of our patients. That way we don't have to worry about how dark the complexion the patient's coming in and what we're treating, and it seems to work very, very well with us. And even on the face, it really speeds up the treatment time, and patients are very comfortable with it. The depth of penetration is also very adjustable as well. It goes from 0.5 down to 0.5 millimeters to 3.5 millimeters. And you can really dial in the RF energy that you're delivering at any particular area. And then the rate at which you deliver and the rate at which the needles go down are very adjustable as well. So here's what's happening. We're looking at just a general overview of when the handpiece is put in contact with the skin, the esthetician or your provider engages the needles, and there's a very, very smooth motor that delivers the needles down, and it's a very, very smooth process that is not the same as other devices. And so some of the other devices that I've seen, it's very jerky, it's very erratic. This is a very elegant process that I think lends itself to being very comfortable for patients. And then once those needles are down, delivered at the appropriate depth, that unique and tailored energy is delivered to that layer of skin, and then that dermal remodeling process begins. So again, here, this is just kind of showing you the different ways we treat different areas of the body and the face. And so you're going to treat higher up for those fine lines and wrinkle reduction and skin texture on the face and some areas of the skin on the body. And then when we're treating stretch marks and other areas of the body, we're going to typically be deeper to affect those deeper layers of dermis. So non-insulated versus semi-insulated tips. This is just nice to be able to have available Again, like I said, we mostly use semi-insulated tips because of our patient populations, and the semi-insulated tips will concentrate and focus that energy deeper where the exposed portion of the tip is. This just reduces that heat to the epidermis and provides that extra layer of safety for estheticians to be able to provide for our darker complexion patients. But certainly, if you have a lighter complexion patient, you can use those non-insulated tips, and you can really get a heating delivery that is higher up to the layer of the epidermis, but is still very, very, tuned in to specifically how you want to treat that particular area. Precise control of fractional entries and RF energy. We talked a little bit about how elegant this device is with our patients. It has a very smooth motor that injects these needles within 100 microns of precision. And I really truly believe that this is why this device is so comfortable for our patients. You can see the other one down below, how jerky it is, and they are not all created equal. So it allows us to really, really customize and push the envelope on our patients for treatments because we don't have to worry about them being comfortable. This is the control panel for our esthetician or our provider that they are able to utilize to change all of these parameters based on not only what the patient's desires are, but what they're seeing and what they're trying to affect in the patient comfort. They can change it dynamically on the fly. And so this really allows our providers to be flexible and really tailor it to that each individual patient. So again, some of these benefits, the versatility, minimal to no discomfort when the patients are being treated. And like I said, in our practice, there is just absolutely no downtime with these patients. And that's the beauty. When you're able to do a procedure like this on a patient with very little or no downtime, they are so much more willing to sign up and come back in or pay even more of a premium because they know they can't have that same effect without the downtime, associated with a laser treatment. So they're much more willing to undergo this procedure than a laser treatment or a very high intense chemical peel. The beauty here for us is, like I said, it's very safe for all different types of Fitzpatrick classifications, as well as, seasonality doesn't really have an impact on it. And we really have started to include this in a lot of different combinations of our treatments, whether it be, facial revitalization plans, when we're talking about injectables, or surgical treatments for patients on body contouring, abdominoplasties, breast lifts, breast augmentations, and so forth. And I believe that the other thing that is so significant about the Secret RF platform is that it yields consistent results. And it's not just consistent results in our office, but when I looked at it and evaluated it with through Cutera, I reached out to a lot of different plastic surgeons around the country and dermatologists and practitioners who were using it. And there seemed to be a very consistent result that each individual was being able to obtain. And that made me feel very comfortable. And it wasn't just a user-specific device, that it was very, very delicatable to whoever I had in my office performing it. So how do I use Secret in my practice? We treat patients of all skin types, like I said, all year round. The most popular treatment really is full facial skin revitalization, and we typically will treat a patient when they come in from the forehead all the way down through the face, neck, and décolleté. But I will tell you what has been ramping up in our practice is now doing more on our surgical scars, the patients that have had existing stretch marks who really want to enhance the result of their tummy tucks and their breast lift and breast augmentations. And then those patients who we've never really had good treatment options for as they get older and they start noticing this more crepey appearance of their skin just above their knees and above their elbows and arms. So we're really starting to bring this in to treating more areas on the body. We do include PRP with our treatments, or at least as an option for our patients, because we really believe that there's a boost to that collagen production. But I also think that it allows for a better and quicker recovery period, and it just tends to calm a little bit of that redness down that you see immediately after the procedure. So let's look a little bit of before and afters. These are some of Cutera's, but I've also included some of our personal cases here at the office. But this is typically what you will see when you're treating, full face and down on the neck and décolleté after 3 treatments. This is very consistent with what we see. We have our estheticians pull that skin of the upper and lower eyelids over the orbital rim and able to treat this very comfortably and really see outstanding effects on this skin around the eyes. This is another very, very strong picture that I love to see to show patients, and I do believe that this is consistently what we see as well. You'll notice that not every single wrinkle is gone. They're significantly improved, but what is so impressive about this picture and most of these pictures that we see with these patients who have had this device is the fact that the pore size, the skin texture and tone is so significantly improved. And this is what patients really, really appreciate. So again, here, looking down close around the perioral region with a patient before 2 treatments where they've had, much deeper, ruddier skin with, larger pores and these perioral rhytids and wrinkles that we've really not had great options to treat. Some of my colleagues will do isolated chemical peels around the areas of the mouth, but this leaves them red and they complain about it, and there's just a skin discoloration and some recovery time. And so we're able to really offer another option for these patients that's really impactful. And when you look at this and you tell a patient, look, in 2 to 3 treatments, we can really have an impact on those lines around your mouth and the pore size and the texture and the tone, and you don't have any recovery. Well, that's a significant change from what they've been used to. Again, around that perioral region, just the skin tone and texture. We treat down onto the neck. It's, everybody has those patients that come in who have spent their time out in the sun and they have this red, ruddy neck with just a very intense, thicker look to that tissue. And this really just calms down that neck skin and makes a much smoother tone and texture to the skin. And ultimately, look, if we have a patient who has a very nice facial revitalization procedure and their skin of their face looks great, but their neck still looks like they're 60 and 70 years old, then we haven't done them any favors. We really need to be able to treat that skin down onto the neck. And this allows us to quickly treat the entire face and the neck consistently. This is another one just showing that changes in wrinkle reduction, a little bit of that skin tightening. You can certainly appreciate down in the areas of the jowl around the mandibular border where you see that skin tightening and really improvement. And, we're not telling patients that we're going to get so much significant skin tightening that you're going to see improvement in the jowls, but we consistently do see these skin tightening effects and patients love it. So the other thing, this is one of my patients. We do treat much younger patients. This is not just something that we're doing on our patients who are in their 40s, 50s, 60s, and 70s. So this is a very young patient who came in and professional, was complaining about, uses skincare products, but just was not happy with the texture and the tone of her skin. There's nothing wrong. She doesn't have wrinkles. She doesn't have, skin laxity, but we want to be able to even the skin tone and make her skin healthier and allow her to look more appropriate for her very young age. So this is her after 3 treatments, after 6 months. And so this particular patient, as well as many others, will come back in after their 3 treatment regimen, and they'll do another kind of touch up or maintenance, so, after 6 months or another year or so. This is another one of my patients. And this just kind of shows this is a very, more complex patient who has more issues with skin complexion, some skin laxity issues, and so forth. And you can really see the significant changes in not only the pore size, but the texture and the tone in the coloration of the skin, as well as some of that skin tightening around the jaw of the mouth or the jaw and down onto the neck that just provides a much healthier and younger look for those patients. Scars, acne scars, it does a great job with acne scars. We don't specifically see a lot of acne patients for this, but patients who we have treated that have had prior acne scars have seen some pretty significant improvements in those particular scars. But scars in general, obviously as a plastic surgeon, we have scars that they come in as after a traumatic injury that they may want recommendations on, or our own surgical patients. And this is something that we will give them options for spot treatment of these scars. We give them that treatment option at a lower price point than if we were to treat the whole entire face. But certainly we see some very nice results with this. This is one of our patients after 3 treatments, and you can see down that area that had that previous scar from a traumatic incident, how it just fades away and makes her look so much more youthful without that appearance of that scar, and just more even tone and texture of the surrounding skin. Now, this is where I think we have really become more excited. You know, our patients who are either they do not want surgery, or we feel that they just may not be a surgical candidate, but we really want to be able to offer them some options with regard to help, you know, tightening up, thickening up, and allowing them to have a better just overall appearance of the skin in certain areas, specifically around the belly button after maybe you know, 2 to 3 pregnancies. And these moms who come in and they're in their 40s and they're very young looking and they're very social, but they just want to do a little, you know, enhancement of the skin around the belly button. And then these older individuals that come in with crepiness over the knees. This is also another popular area that we're being treated. We are treating more now, stretch marks. So traditionally, this has been treated with laser treatment. They can be a little painful, and our patients have really caught on to this, and this has been just more by word of mouth. Patients that we've had surgically and we've treated a certain area after a tummy tuck or after their breast, they come back and they say, look, you know, it works so well on this area for our stretch marks. I really have some areas that I really would like to improve as well. This is a patient after 3 treatments, after 3 months. And, you know, you're never going to completely get rid of stretch marks, but you're going to significantly improve them in these patients who have, you know, these beautiful figures and want to be able to wear their bikinis and bathing suits and otherwise feel that they can't because of these stretch marks. Again, like we talked about before, you know, we're starting to see, or we've always really seen these patients with this increased crepiness or wrinkling above their knees, around their elbows, and we've not really had a good option for that. And so we have been utilizing Secret for these patients, and it has really been showing some very nice results. This is a patient of mine after just 1 treatment. And the reason why we only did 1 treatment is we were kind of testing it out on her, and we did 1 treatment. We said we wanted to have her come back, and she'd gone out of town and not come back. And then 6 months later, she came back in and she said, you know what? I really saw so much of an improvement on that. I think I'd like to try some more. And so, you know, I think that this is something that has been a very nice addition to our practice, because every patient that we speak to with regards to body contouring, once they get to a certain age, they're going to have these issues, and we've never really been able to have a great option for them. But now we can have an option for them to present with them to really enhance their overall results. Again, this is one of Cutera's results, but this is after you know, a treatment, a couple different treatments in this area. And again, this is, you know, once patients get into their you know, 50s and 60s, or after massive weight loss, if you're doing a thigh lift on them, you don't always have that effect on that skin right above the knee. But how nice would it be to really be able to enhance and complete that result if you're doing a thigh lift or something like that, to help out that tissue around the knee and just make it a fully complete result. So let's talk a little bit about consultations and marketing. You know, since we've been quarantined here now for a number of weeks in our city, I sent all of our staff home. We've been working remotely from home. We've adjusted our hours from 9:30 to 4:30, and the staff has been taking time to just really follow up on previous consults for facial rejuvenation and liposuction, and then reaching out to our patients and talking about, you know, these devices and these offerings that we have that we may not have talked to them about before when they were here. We're also having the staff work through our before and after photos for body contouring and for injection patients, and really looking for opportunities to enhance what we have already done to these patients with the Secret device. And so right now we're doing complimentary consultations through virtual consultations, and we're really just trying to load up that schedule for when we can reopen and get things rolling again. And so right now, because this device is so reasonably priced with regards to disposables, we're offering incentives for patients that schedule and pay now for their treatment to be performed when we reopen in the next couple of weeks, hopefully. So how do I introduce the secret RF in our consultations? And I really feel like it's an easy thing to talk about. I find myself discussing this with literally every single patient that walks in the door, whether they be an injection patient or a body contouring patient. Secret comes into the discussion as just a part of that treatment plan. And so it really has allowed me to quickly start the conversation of secret because I'm always thinking about it on every single one of our patients. And then I allow my staff to follow up with them, review pricing, and go over treatment schedules and options. But at least we have it as a part of their treatment package, and then we can really tailor that based on what they're doing surgically to a potentially lower price point that the patient feels comfortable with, and that is still very beneficial for our practice as well. Listening to our patients. So, in our facial revitalization or rejuvenation patients, I really try to formulate a complete plan for patients. I try to listen to them and really find out what's bothering them the most, and then we come up with a full plan. And I try to tell patients it's not about doing everything at once. It's kind of like buying an older house and remodeling that house. You don't have to do everything at once. You do things in a stepwise fashion and do a little bit here and a little bit there. But in the end, that whole result is going to make things look better and better and better as you do those additions or those renovations in each of those different rooms. And secret has just become a part of that regimen or that plan for most of our patients. So what we have found with our particular patients is the fact that there is no pain, there is no downtime. It's a fairly quick procedure that has noticeable results and that is very safe and effective. Then they feel like it is a tremendous value, even though it is at a much higher price point than traditional microneedling. You cannot compare the results of traditional microneedling with this. If you're doing just 3 treatments, you cannot compare the downtime with secret compared to some of these other modalities. And this is what patients are understanding, and this is why they are seeking these treatments out. So Cutera really does a nice job to really support your staff and your office in being able to get this information out. mycutera.com has Cutera Camp. In Cutera Camp allows for your staff and your office to really access anything that you need at any particular time to be able to market through social media, your website, email blasts. It gives you ideas and options, videos, things that you can run in your office and the lobby. So it really does make it much easier on your practice and in your staff in the practice to be able to not have to think about what do I need to do? What do I need to? How do I need to create some marketing material for this? In addition to this, Cutera also provides practice development managers, and these people are assigned to your practice to be able to develop a marketing plan and really execute it as well. And so we've used our PDM many times to develop not only plans for social media, but also, more importantly, events at our office. And so these events are based around this particular device, Secret, or maybe even other devices. But the PDMs will actually help arrange these and organize these events. And then they will show up at your event to help run the event, to talk to patients about it. And that becomes a night where we may have 30 people in the office that become excited about the device once they hear things and see things. And then you're able to just schedule those patients immediately at that time. And we've done a couple of these with our PDMs, and last time that we did it, we felt like we've kind of gotten a hold of it, and we probably didn't need our PDMs support to do it. And we really felt like it's so fun and so beneficial. We need to be doing this in our office quarterly. So Cutera's support team is really good. And one of the other things that I considered when I was evaluating higher technology and microneedling or RF microneedling devices was the company itself. And so I really felt comfortable with Cutera's brand and their reputation in the marketplace, and the fact that they've been around for so long and they anticipate being here for so long as well. And so with that, they're always available. They're very good about supporting their doctors and their providers, being able to provide clinical trainers to come in, doing live trainings in-house or doing it over webinars. They really do a good job of being able to support the practice because they want you to be successful with the device. So how do I market, particularly with Secret in our office? And so, like I told you, most of the time, this is through patient consultation. We just find ourselves talking about Secret with almost every patient that walks into our door, regardless of what we're talking about. And then it seems to be through word of mouth and patient referrals. So we will have patients calling in wanting to discuss Secret treatment because they heard about it from their friend and they saw the results that they had. But outside of that, social media is a great platform for this because it is so visual. In office, we do video loops of things to just show patients what it looks like and what it's about. But I think that it's an easy thing to really market because there's nothing to really hide about it. It's safe, it's effective, there is no downtime, and that just really makes it easy to talk to patients about. So since we've gotten the device, there's really been a steady increase of patients desiring the treatment. We've really expanded some of the indications and applications to areas of the body, and I think that this will continue to rise. And because of this kind of low disposable costs, we've really been able to run specials with larger discounts for treatments. And if we're doing a surgical procedure that's a high dollar procedure, I feel very comfortable discounting that treatment for Secret, potentially 50%, just as an adjunct to really fully enhance their treatment, because I want them to be able to look their best too. And I still feel confident that we're still making money off of it, covering all of our costs as well, and the patient has the best of both worlds. So with this, we're going to open things up to questions, but if you guys have any questions regarding any information pertaining to Cutera and the Secret RF device, or want to schedule a demonstration, this is the contact information to call and email. They will get back with you very quickly to set those demonstrations up. They're very good about it, and I think that if you consider the device and take a look at it, a close look, and talk to other people that have been using it over the last year to 2 years, you'll find that it's a very consistent experience, and I think that's what made me feel most comfortable. But if you have any questions with regards to the device itself, I'd be happy to entertain them. Thank you so much for your time.
Hi, everyone. I'm so sorry. I was mute. And so this is Inga Hansen from Metasthetics. And Dr. Sands, thank you so much. We do have some questions coming in, and I was starting to ask them too, and I realized no one could hear me. The first question I had is, do you use a topical anesthetic cream for the procedure?
I do. Thank you, guys. Can you hear me?
Yes, I can hear you.
Okay, perfect. So we do use a topical numbing cream. We have a compounding pharmacy right next to us in our building. And so we use a combination tetracaine and lidocaine cream. It's about a 23% and 7%, and that works very well. Well, typically, on the face, we'll let those patients numb for about 20 minutes, and we'll if it's a patient that's super sensitive, we'll let them numb a little bit more. In body patients, we will let them numb a little bit longer, perhaps 30 to 40 minutes, because sometimes the body, especially like on the inside of the arms, tends to be a little bit more sensitive. But when once you have that topical numbing, it really doesn't require anything else other than the topical numbing for the patients to feel very comfortable during the process when it's being performed by the esthetician.
We had a question about during the consultation, how do you walk through in terms of looking at the patient, speaking with them? How do you determine the package they might need in terms of number of session and the pricing on how you set that?
So, in general, if it just depends on the type of patient that's coming in, what their age and what the condition of their skin. So, if it's a fairly young patient who is wanting a little bit of a revitalization, wants to improve the texture and the coloration of her skin, then that's somebody that we would consider just saying, just do one treatment and then you'll do another treatment, later down the line, later during that year. But if it's patients coming in and they're in their 50s or 60s and they have obvious degradation of collagen and elastin and they have some deeper wrinkles, that's a patient where we're going to say, look, we really recommend you to have three treatments kind of back to back. And that's just to start off with. And because we really know that, to get to those clinical endpoints for more advanced patients, you really do need a couple of treatments. Three treatments, I think, is probably more equivalent to 12 or 15 traditional microneedling treatments. And to do three treatments 4 weeks apart is very simple to patients. The way we position this for patients, because it is a higher price point, I think really what sells itself is the fact that patients do not have to worry about downtime and recovery, and that in itself has a lot of value. But we do discount that package, and so we will take off if somebody is committing to three different procedures in a package, and they pay for it all at once. We'll heavily discount that package of three, and then going forward for those patients who have committed to that three treatment package, if they want to continue going further for more treatments or they want to do periodic maintenance every 6 months or every year, we give them a discounted price on the individual treatments that they would do after that because they've committed on the front end of that. And we really truly believe that you've had corrective effects that are going to be permanent, but the aging process continues, and so we want them to continue to be preventative and try to continue doing this treatment as more of a preventative or maintenance procedure as well.
And how long does it typically take to treat a full face?
So I will say that when we first started doing this, our esthetician was doing about two treatments per day, and it was because they were, very careful with things, and they didn't have their protocol and their efficiency down. But now they're at a point where they're doing four per day, and I think that in between they can do other things, while a patient's numbing or while they're in a cool down phase with a cryo mask or whether they're under the LED light or something like that, they can do other things. But right now, the whole process, which would include, 30 minutes of numbing, the procedure itself, which may, take about 20 minutes or perhaps a little bit longer, and then the cleansing of the patient afterwards and cooling them down with a couple of different products and a cryo mask and possibly LED therapy. It usually takes about 2 hours from start to finish, which for a procedure like this, I think patients can get in and out in 2 hours is not a bad time, and they've done very well with that, especially because they can walk out of the office and go straight to lunch or go do whatever they feel like they need to do and not feel like they have to go shelter in place in their home because they're red and they're bleeding or things like that.
In terms of like the stretch marks, which is just something that's been so traditionally hard to treat, we have some questions about what are your settings when working with stretch marks, and someone was specifically asking about the inner thigh. How do you treat that with the RF?
Yeah, so the settings, what my esthetician is currently using, I have to go back and look. I think on one of those screenshots, the on our stretch marks, that is our traditional setting right there. I do tell patients When we treat stretch marks, we will usually need to do more than just say 3 treatments. So I usually tell patients, be prepared for 4 treatments in an area, but we actually price our body patients different because when you're doing the body, it's typically a quicker treatment than when they do the procedure on the face, and so we position that a little bit less of a price point for patients, so that it's a little easier for them to say have 4 and potentially 5 treatments for stretch marks. The inside of the thighs is one of those little bit more sensitive areas, but we found that using that numbing cream and allowing it to sit for a period of maybe 40 minutes or so, and then sometimes using an occlusive area like Saran wrap over that area gets a little bit better penetration on those sensitive areas, and patients tend to tolerate it much better after that.
Great. In a lot of the photos, we saw a great improvement in texture and tone. There was a question here about, does it help at all with the broken capillaries you see around the nose or on the face?
Yeah, that's a great question. I think I don't typically advertise it for reduction of or resolution of broken capillaries because I tend to refer those to our dermatologist that's here in the building for laser treatment or spot treatment. But what we do notice is there is significant improvement in the redness that's associated with these, and you get a little bit of improvement depending on the size and how superficial they are and so forth. So I don't market it to patients and say we are going to get rid of these, but we do see significant improvements in just the overall appearance and the obvious nature or the redness of those areas. But I just don't. I think that's more incidental, and I don't say that we're going to treat this and be guaranteed that this is going to resolve.
Mm. And is it safe to treat on the neck and chest with the secret
Absolutely.
RF?
Right. So for our facial patients, every single one of our patients, with this device, you get a certain number of pulses that is in each head, and it's in the thousands. And so when our esthetician starts off, she starts by treating. She's kind of got a protocol, and so she'll do the less sensitive areas first on the face, and then she'll do the more sensitive areas as she gets further into the procedure. But by the time she is done, she will have treated the entire forehead, mid face, lower face, around the mandible, neck, and décolleté. And that's standard on every single one of our patients. So they don't pay for any more for that entire treatment. And usually, if they've treated that entire area, sometimes they'll have some pulses left over, and they'll treat the back of the hands for the patients because we want them to be able to have the full benefit of the pulses that are left in the of the head, and then get really some of that benefit on other sun exposed areas that may have skin discoloration or textural changes like the back of the hands. So yes, we routinely treat down onto the décolleté and neck on every single facial patient because these are all the same sun exposed areas. These are all are visually exposed as well. And so if we have a patient that we're creating these textural changes and color changes in the face, we want it to run down onto the neck and décolleté so it's a full complement.
And do you have, what is the post procedure protocol, and do you recommend any topicals or lotions immediately after treatment?
Yes, we do. We've kind of refined that a little bit, and we use a lot of revisions products. We love the product line because it's so um, easy on the skin and it's not very acidic and it tends to not aggravate these open channels. And so our esthetician will use some of their hydrating serums and some of the other products to kind of cool and soothe the skin. We've also begun using some of Elastin's products as well to try to cool that skin down. But we use a cryo cooling mask by Amp Medical immediately afterwards. And I think that in itself, along with the addition of platelet-rich plasma, does a lot because as soon as they're done with the procedure, the patient does have a fair amount of intense red discoloration. But once you put that cryo cooling mask on and the PRP and allow them to sit for a little while, it's amazing how that redness dissipates. And then, if need be, afterwards, if there's still some inflammation, we'll put them under an LED light for about 20 minutes or so afterwards. And then by the time they're ready to leave, they're just ready to go. Now we also too we give all of our patients a package of skincare. So if they're doing 3 treatments during that 3 month process, we want to know what they're putting on their skin, and we don't want it to be left to chance. And so in order to do that, we give them a whole entire package of skincare that we feel that would be sufficient for them and is not going to be detrimental to those open channels and be inflammatory. And so we ask them to use that during that 3 month process. And typically patients will like that regimen so much that they'll end up coming back and purchasing products afterwards too.
We've had a number of questions that have come in asking about the pricing of this, and with the understanding that this can vary by region, what do you typically charge for a full face rejuvenation treatment?
So our full face rejuvenation, if we're just doing 1 treatment, is $1,250, and that includes, everything that I've talked to you about, all of the post treatment, PRP, mask, and everything. And then if they do a package of 3, we discount that, and so it's down to $1,000 per treatment. So it's a $3,000 package for the 3. But when they do that package of 3, we also give them a full package of skincare that we want them to use, and so that usually that usually has a cleanser in it, a hydrating sort of serum, an SPF physical blocker in it, and then some other things to allow them to care for it during the process. And so then afterwards, I mentioned this before, but when patients come back after that 3 treatment regimen and say they want to do, 4th or 5th treatment, or they want to do some touch up or maintenance, 6 months down the line, then we give that individual pricing at $1,000 for them. And then with regards to the body patients, again, this is a quicker procedure for our estheticians to do. And so in general, this is usually, depending on the area that we're treating, it can be anywhere from, $500 to $750, depending on the area we're treating and what we're doing.
And we're getting a little bit low on time, so we're going to have time for one more question. I just wanted to let everyone know, though, if you've sent in questions and we haven't gotten to them, we will follow up and make sure you get an answer. And if you want to review this or share this, it will be on the medestheticsmag.com/webinar site later today. So for our final question, someone's asking, if a patient is having Botox injections, can you do this treatment on the same day, or do you separate them?
Yeah, that's a great question. I tend to separate them by a week, and so a lot of our patients are Botox and filler patients, and so most of these procedures are being done by our esthetician when I'm in the operating room anyway, and so I usually just have them separate their injections by a week from their treatment, either before or afterwards.
Wonderful. And I want to thank everyone for joining us on this webinar today. And Dr. Sands, thank you so much for joining us and for the presentation.
Thank you so much. I appreciate the opportunity.